Well, many countries around the world are celebrating Mother's Day today, traditionally the second Sunday in May. Other countries celebrate on a different date during the year. But no matter when you celebrate, it's still a time to stop for a moment to reflect and show appreciation for what many of us consider the most important person in our lives, without a doubt. But while roses are often the gift most associated with Mother's Day, the situation is far from rosy. Every year, the charity called Save the Children ranks the best and the worst places for moms. Norway rose to the top of the list for 2015. The United States sank to 33rd, way behind other developed countries. Somalia came in last for the second year in a row, and here's a sobering statistic. In the developing countries, more than 350,000 women die from complications with pregnancy and childbirth each and every year. Well, Dr. Taraneh Shirahzian is the Director of Global Health at New York's Mount Sinai School of Medicine and the founder of Saving Mothers, an organization that is just a wonderful, wonderful organization. Tell us more about the organization itself.
Yes, so Saving Mothers is a nonprofit that I co-founded in 2009, and our main goal is to eliminate death for women globally in pregnancy and childbirth from preventable causes. So many women die of completely preventable things, and so our organization is dedicated to developing medical programs for women in areas of the world where they face death.
You know, you say presentable, and I certainly am not going to dispute that with you, but if they're so presentable, why do they continue to happen? Is it a lack of awareness? Is it a lack of money? What's going on?
It's lots of things. It's a very complicated issue, which is why disparities in healthcare is such a huge discussion point, I think, even today. So some of the things that affect it is the low education of the providers that take care of women. So women usually are not delivered by experienced or trained skilled attendants. They're usually delivered by, in many places, traditional birth attendants or low skill level providers that can't identify complications, that don't know when to refer in the event of an emergency. So some of it is that. Some of it is lack of access to hospitals. Some of it is lack of access to resources, transport of women from very rural areas into urban areas to deliver. So there are a host of issues that affect this.
Dr. Shirahzian, the question that I have here is, it's a very simple one and a very blunt one.
Sure.
Women have always been the brunt of humanity's ills.
Absolutely.
Over the years. Is it just perhaps that men don't care?
Well, absolutely. So women's human rights is a huge issue that we deal with in many countries around the world where women are not prioritized. I mean, we're talking about almost 500,000 women a year that die in pregnancy and childbirth. And that is just a rough estimate. In many areas of the world, there's no census data collected. So we have absolutely no idea what that true number is. But would we stand for that if it was another medical issue?
Sure.
I don't think so. I think because it affects women in many societies, it's not prioritized. So Saving Mothers is really dedicated to preventing these deaths. And on Mother's Day, where we spend $1.9 billion on flowers alone in the United States, we ask that people think about giving back to organizations like Saving Mothers and other organizations that takes care of women around the world.
We want to put that out in the forefront, Doctor, but also, I couldn't end a segment here without you giving us some positive news about what you've been able to accomplish with your organization.
So I'll just tell you about what we recently launched. So I just got back actually yesterday from West Pokot, Kenya, where we launched a new program for women where we trained the doctors that serve 300,000 at the main hospital there how to do ultrasound. So they're able to identify early issues for women in the early part of their pregnancy. We're hoping it's going to encourage women to come into the hospital for care because many are not even trusting the hospitals enough to come in. So we're hoping it will encourage access to care for women. And we're also doing preterm birth indicator kits where we're going to identify the women who are more likely to deliver preterm in order to have them stay closer to the hospital near the end of their pregnancy so we can prevent maternal death and newborn death. And it's a huge success so far, and we're very excited about it.
I see the excitement on your eyes and it's good to see that, and the good things are happening. Dr. Taraneh Shirahzian, thank you for joining us.
Thank you so much. Thank you for having me.